Hey everyone, today I'm going to be going over muscle therapy and how I utilize that in my office. So there's a lot of different techniques that go under muscle therapy. A couple examples would be like trigger point therapy or myofascial release, where I'm applying direct pressure to a muscle in order to get it to relax. A couple other movement-based techniques would be like passive release technique, where I'm moving your muscle while we're applying a stretch, or active release technique, where I'm still applying the stretch, but you're actively moving the muscle. And then there's something called instrument-assisted soft tissue mobilization, where if you've ever seen a chiropractor or a physical therapist use a little scraping device to scrape over the skin, what we're doing there is we're trying to get blood flow to the area in order to assist that healing response, as well as piggyback off of the Golgi tendon reflex in order to get that muscle to relax. So the way that gets used in a therapeutic setting is, if you recall the pain cycle, an injury is going to cause muscle tightness to occur, which then leads to an altered movement pattern, which then causes joint stiffness and then back into pain. So we're interjecting ourselves into that cycle in order to get the muscle to relax. Typically, I'll couple that with some sort of joint mobilization technique so that we can get everything nice and relaxed, so that then we can start working on controlling the joint. An example of that in active care would be if somebody comes in with neck stiffness or neck tightness or neck pain. I'm getting the muscle to relax by either stripping the muscle or having you move through a stretch while I'm pinning that muscle down, and then I'm utilizing either a chiropractic adjustment or a joint mobilization in order to restore that joint motion. And what I have found is utilizing the muscle therapy and the muscle rehab in order to get the muscle to relax before I actually perform the adjustment or joint mobilization, it actually helps get that adjustment to release a lot easier. So I really don't have to apply as much force to the joint when we're trying to get it to move. Which, one, feels a lot better because there's not as much tension on that joint, but then two, it also makes it a lot safer, because if I don't have to apply as much force and really whip it to crack it, it's going to be a lot safer if I just have to put a little bit of force into it to get it moving. But then we'll typically finish that up with some form of exercise so that you can reestablish control of the neck, whether it's activating the deep neck flexors or getting the mid-back muscles into control. So there's always something that I'm teaming up with, getting the muscles to relax and get the joint moving. That way we're not just getting the joint moving and then throwing it out into the world and hoping for the best. So if you have any questions on muscle rehab, things like that, or if you just want to know a little bit more about the process, drop me a comment, and I'd appreciate liking and subscribe. Have a great day.